Good morning, my name is Dr. Jeremy McAnulty from New South Wales Health, and I'm here to give a COVID update for New South Wales for Monday the 22nd of November 2021. Overnight until 8 o'clock last night, there were 180 cases of COVID reported in New South Wales. In the same period, there were more than 45,000 COVID tests reported. In terms of vaccination, 94.4% of people aged 16 years and over now had one dose of vaccine, and 91.8% are now fully vaccinated in New South Wales. Of people aged 12 to 15 years, 81% have received a first dose of COVID vaccine and 75.4% are fully vaccinated. In terms of hospitalisations, there are currently 202 people diagnosed with COVID in hospital in New South Wales, 30 in intensive care, of whom 15 require ventilation. Of the people in ICU, 22 are not vaccinated, 3 have had one dose of vaccine, and 5 have had 2 doses of vaccine. Sadly, we're reporting the death of one person today with COVID. A woman in her 50s from southwestern Sydney died at Campbelltown Hospital. She was not vaccinated, and we'd like to express our sincere condolences to the lady's family and friends. Today, we're again reminding people of the health guidelines for people returning from overseas. The guidelines include requirements related to testing and restrictions from certain high-risk premises. You must have a COVID PCR test within 24 hours of arriving in New South Wales, and also on or after day 7. You are not required to isolate while waiting for these results unless you have symptoms. If symptoms present at any time, please go and get a PCR test right away and isolate until you get a negative result. New South Wales Health is contacting people who've recently arrived from overseas to remind them of these requirements. We're also encouraging people planning to host overseas guests to make sure that they are fully vaccinated before the guests arrive. And please remind guests about these testing requirements and to watch out for symptoms and to support guests in getting tested and avoiding those high-risk settings. We've also been seeing a number of COVID cases in schools, so we're urging people, particularly parents, to remain vigilant about symptoms in children, which can be quite mild. And if your child does get any symptoms, please keep them away from school until they have a negative COVID test. Remember, a PCR test is important if you have symptoms, and they're readily available at one of our many clinics across the state. And just a reminder that 12 to 15-year-old children are eligible for vaccination, which can be accessed through GPs, pharmacies, or one of our state clinics. So thanks everyone for coming forward to getting tested if you have even the mildest of symptoms, and for getting vaccinated if you're eligible. Don't forget to have a booster if it's more than 6 months since your second dose, and to have that second dose if you haven't yet had it. Thanks very much.